Εκεί.
I'm very glad to see all friends and colleagues here under one umbrella, moving forward to promote medical tourism of Greece. This is what we have done 10 years ago as Turkish Healthcare Travel Council, while I'm leading the Turkish Healthcare Travel Council. So we have established 2005, and since then we are promoting strongly our destination. But as last year, including Greece as a founding member, we have founded Global Healthcare Travel Council, and Greece this year are leading as the vice president for the Global Healthcare Travel Council. We are happy to collaborating all together to create a new understanding and new rules and regulation to put all ethical understanding for global medical tourism movement. So we are happy that Greece taking place together with us in this initiative. First of all, I'm happy to see really that you are coming together now under one roof to promote Greece as a destination. We as Global Healthcare Travel Council are ready to support this initiative and movement, of course. How we can help and support. We have 72 network offices worldwide at the moment who are referring patients or who are sending patients to any other destinations. So as soon as Greece will be ready under one umbrella with its internet visibility and with all organization, then we will start to promote Greece as one of the destinations for medical tourism, and all our network offices will start to refer the patient to Greece Healthcare Travel Council members. So at this moment, Global Healthcare Travel Council, this is the second year. We are still baby, trying to walk. But however, one of our Greek friends in our advisory board, he is working with this committee very hard to put together all the ethical and patient right understanding for global wise. So we are working on it very hardly. I believe that until the end of the year, we will gonna do our declaration with our ethical understanding and patient right for global understanding. So one of our advisory board members responsible for the education, Dr. Maria Todd, she is now working on education and certification for the facilitator, for the hospitals, international patient departments, and for the marketing of hospitals for international patient marketing. So all these certification programs will going to start 2015 onward. And hopefully we will get enough support from your participation to our local association. Under your association, you will be represented globally, and you will be represented in 72 countries where we already have our network office from New Zealand up to Canada and United States. So today we are almost reaching 30 countries as a member of Global Healthcare Travel Council, including United States. Since long year, I can say that more than 70 years United States was a destination for medical tourism. All of us know that so many people, even from Turkey, even from Greece, was traveling very often to the United States for heart surgery or other treatment as well. But today, within our initiative, Global Healthcare Travel Council, they start becoming together, as same as Greece now. Before they were acting individually, so they understood as well to become under one roof, under one umbrella, to be represented in Global Healthcare Travel Council organization, that they can get a right number and good number of patient movement from other countries to the United States too. So the initiative of United States Medical Tourism Healthcare Council is just taking question, I'm here at your service to reply your question.
Νομίζω ότι έχει ερώτηση να πλησιάσει στον προγραμματιστή στην πρώτη σειρά και να ρωτήσει. Υπάρχει κάποιος θέλει να ρωτήσει κάτι?
My name is Alexander Lamnidis. I'm representing the Confederation of Greek Tourism. I'd like to, thank you. I'd like to ask, as far as facilitator companies are concerned that are facilitating this whole process, what have you done in Turkey relating to, if you like, some kind of standards as to whether they're actually passing through some exams in order for them to be able to participate in this whole process? Have you ever evicted anyone from this particular circle of companies? How do you do it? Thanks.
The criteria was for facilitator that they need to have 5 different language websites, which are English, Russian, Arabic, German, and French. Those 5 languages, the main language, which are mostly used in the world. So they have to open up their website first. They need to have foreign language speaking personnel in the company, not part-time, full-time working in the company. And the facilitator, they need to have at least one general practice doctor, not full-time but part-time, that he can assist medically when they receive any reports, medical reports, or if they want to report medical reports to the patient families or patient itself. So we put these criteria and then we start do the accreditation by our council since 2005. Whoever, up to now we have 14 facilitators in Turkey who are accredited in our council. And all of this facilitator are completed all this criteria, and then they apply to us. We check their website, we check their office, we check their staff experience and quality of speaking different languages, and then we give them right to go ahead and promote medical tourism as a facilitator to facilitate the patient and between the patient and the hospitals. So this type of criteria we are ready to share with our colleagues in Greece, that they can settle the same criteria. For the general hospitals, we were asking to have at least an international accreditation, like GC accreditation or equivalent accreditation from Canada or from United Kingdom or from Germany, like HEMOS. So we have certain 5 or 6 international accreditation company who will do the international accreditation for the hospitals. So we asked those criteria, and this is first criteria for hospital. Second criteria, we are asking that they have to establish the foreign international patient department who speak different languages that handle the patient inside of the hospital and the communication in between international facilitator and doctors to facilitate all the information. So those are the criteria we put for general hospitals. But meanwhile, of course, from 2005 up to 2010, our great supporter as a government side was the Ministry of Tourism. Ministry of Tourism was supporting us, giving us enough space to promote ourselves in international exhibitions like WTM, like Berlin, like Milan, like Arabian Travel Market, like Mid Moscow, like Kiev. So we were taking place in the national booths of Ministry of Tourism of Turkey. They give us enough space to promote medical tourism as a destination as Turkey. So this was the great support was given by the Ministry of Tourism in the beginning until 2010. And after 2010, Ministry of Economy become as major part of our industry, and they bring new incentive and new law supporting to promote competition. If the hospitals would like to promote themselves in any medical tourism exhibition internationally, they are paying from 50 to 70% of the cost of the exhibition goods, flight cost for 2-person, and accommodation cost for 2-person, represented from the hospital. So if the hospitals would like to, or the association would like to do market research about one country, whether this is a target country for us or not, they are paying up to $150,000 report for market research. And if the hospitals would like to promote themselves in Google, in Yandex, in contacting Russian countries, or in any television or any radio or any magazine, they are supporting up to 50% all this promotion, up to $300,000 per year per organization, per hospital. So all this support and incentives become 2011 onward to support medical tourism, plus to attract more patients to Turkey from faraway distance, like 2-hour, 3-hour distance, 300 euro, 400 euro flight tickets is easy to cover by the patient. But when you consider United States, when you consider Australia or New Zealand, the flight cost to Turkey at least $1,500 or $2,000. So what we have done for African countries, for faraway countries like over 4-hour flights, if any patient would like to travel to Turkey and treated in Turkey, Ministry of Economy are covering up to $1,000 flight cost for the patient. That is another incentive of Ministry of Economy are supporting to our member of council, member of hospitals, to attract more patients, even far away distance. Within this flight support, the patient are not thinking the cost of the flights, because at the end they are getting up to $1,000 reimbursement when they arrive to Turkey, when they declare their boarding pass, when they declare their invoice that they already treated in the hospitals. Within this 2-paper boarding pass and the invoice of the treatment, they can get up to $1,000 in support of their flight to Turkey. So these are the most important issues now. The government of Turkey is really taking this initiative and supporting tremendously the medical tourism development in Turkey. So that's why last year we closed down with 657,000 patients, international patients, from 144 countries. So from 144 countries we received over 600,000 patients, and our revenue was just for treatment $4.6 billion of revenue. So if we include the accommodation in the hotels and the ground handlings, it is almost reaching $5 billion with 657,000 patients last year operation. So this is how we put together since 2005, but I can tell you that strongly, only last 2 years I can see now our colleagues from Greece taking place in international exhibition, medical tourism exhibition, and representing a very good way, representing the destination. Last year in Monaco, and last year again in Kiev, and this year was in Dubai. Greece was represented very high level and very highly. That is how we started to promote our country. But what we are doing up to now, we have realized more than 350 activities, international activities up to now. So that means that every year we are showing up in international market, in international exhibition, more than 30-35 times a year. So about 15 of this exhibition, we are joining with Ministry of Tourism for targeted countries tourism exhibition. We represent our destination together with national booths, and the other 20 exhibition, we are taking next 2 months we will be in Kiev, we will be in Baku, and we are organizing our B2B workshop. We are participating to joining to international medical tourism or regional medical tourism exhibitions. So you need to have a target of 20, 30 countries, and you need to be there every year. I mean, 1 year you go, people, they will see that Greece, a destination, trying to promote itself. But they are never trusted if they see one time Greece presenting there. When they see next year and year after third year, the people, they start trusting that, yeah, really, Greece are insisting and Greece are stable, promoting themselves as a medical tourism destination. I mean, this promotion should be continuous promotion. 1 year we have been, oh, we don't have anything, we should not go. No, this is not right. I mean, you need to go continuously, 3 years, 4 years, 5 years. Some countries are very conservative, like Russian countries are moving now to Israel, moving to Germany, moving to England, moving to America. We started in Russian-speaking countries like last 5 years, promoting strongly. After the third year, we start receiving the patient. I mean, 3 years, we really promote and promote, continuously promotion, continuously taking place in the exhibitions. And then people, they start understanding that Turkey is one of the destinations we need to try and we need to go. So this has to be the way of Greece need to take this initiative and go forward, collaborating with Ministry of Tourism and collaborating with Ministry of Economy as well.
Thank you very much. You were you provided far more information than I had asked, but this is very good.
Thank you. Yeah, most welcome. Any other questions?
Just a minute, we have to move them around.
No problem, please.
In Turkey, set up packages for various hospitals, and if so, which is the most popular packages? Let's say 1 week, 2 weeks, and so on.
First of all, there is simple package, which is more or less 10% less, 10% higher, can be difference. That can be compensated by the hospitals. That package is like hair transplantation package, aesthetic surgeries, knee replacement, hip replacement. I mean, there's fixed cost of the material and fixed cost of the hospitals. Those are the simple and fixed packages. Out of these packages, the facilitator never offer any package. I mean, there is some ready packages, like aesthetic surgeries or some other, like dental surgeries, implants or some other treatments. But out of that, mostly, the process are going like this. They receive, I mean, the facilitator receive the patient medical reports first, then they transfer it to our member of councils, several hospitals at the same time. They never forward to one hospital. In that specification, for example, if the patient are looking for bone marrow transplantation, then in Turkey there is 4 or 5 hospitals are doing bone marrow transplantation. So the facilitator are forwarding the same request 4 or 5 of these hospitals at the same time, and getting different opinion and getting different prices as well, because every hospital has different cost and different charge for that kind of treatment. Same treatment, but different cost, because they are in different city, they are paying different prices, different salaries paying to doctors, different rental costs they are paying for the buildings. They have different expenses. So accordingly, there is different prices treatments. And we give different options to the patient. If the patient would like to treat in Antalya, they go to Antalya. If the patient would like to stay in Istanbul, they come to Istanbul. So the final decision is belonging to the patient always. Our facilitator or our network office never push our patient to go to Turkey or to go to India. They give different options. At the moment, our network offices getting price from India, from Thailand, from Turkey, from England, from different sources, and offering to the patient different destination and different prices. And I can give you a last example from Kiev. There was a child of 8 years has sarcoma cancer behind of his eyes. And they got the offer from us, they got the offer from England, and the patient preferred to pay £150,000 instead of £70,000 in Turkey, almost half price. He preferred to go to England because the doctor, the professor in Harley Street, was a professor, a specialist